So we get to speak about fifth metatarsal fractures. I've just marked that there. The fifth metatarsal is in line with your little toe on the outer border of your foot. This is an x-ray of your foot, and we're just going to mark out that fifth metatarsal bone there in red. There are a number of different types of fractures to the fifth metatarsal. Some of them you don't have to worry about, and others that you do. This x-ray here is what's called a fifth metatarsal avulsion fracture. So it is a not too serious injury. It can look quite nasty, but the good news is you can weight bear in a boot for a total of 4 to 6 weeks. The majority of patients will get better over that time period. I don't generally repeat x-rays for my patients with this injury, as it takes a long time to look better on an x-ray, and generally symptoms get better before the x-ray does. So I only re-x-ray patients if there are ongoing symptoms after more than 3 months, but you will find that surgeons vary in terms of how often they x-ray this injury, but in general the x-ray is not improved by 6 months, but 6 weeks I should say, but most patients have improved from a symptom point of view in that they're having no pain. So this is it's very unusual to operate on that fracture. This is what's called a fifth metatarsal spiral fracture, so it's further up, and they can look really nasty on the x-ray, but once again are very stable and rarely requires surgery. Once again, it's a weight bearing period in the boot of between 4 to 6 weeks. And I once again don't re-x-ray these injuries unless the patient is still having pain. It's around the 3-month mark, full stop. Now this is the one you need to worry about. This is what's called a Jones fracture, and it occurs to about a third of the way up the bone of the fifth metatarsal. It's usually a low energy injury, and the problem with this injury is that the blood supply is not that great, and as a result there's a risk of something called non-union. Now we're going to mark it out again here, and the non-union rate is up to 30%, it's almost 1 in 3, and non-union means that it doesn't heal. So 1 in 3 of these are going to have an issue with healing. The other thing is, if in terms of the time it takes to heal, it's almost 14 weeks, which is a long period of time. So there are ways we can get around that, and one of those ways is surgery, and that's to place a screw percutaneously up along the bone, and that'll take your non-union rate down to 3%, so significantly down on where it is if you're treated without an operation. And the other good news is that the average time to union, or average time to healing with an operation, is a bit over 8 weeks, as opposed to almost 14 weeks without an operation. So that's the one you really need to look for and discuss with your surgeon as to what your options are, or your doctor. I hope you've enjoyed our video today and found it informative. Please take a look at some of our other videos, or subscribe to the Foot and Ankle Orthopedic Surgeon if you found today helpful. Thanks once again for listening.